So before we move into that, I just wanted to share some data that's specific to North Philadelphia, which is where we are in the heart of right now. A lot of the data that we get, we have received from the Public Health Management Corporation. Every 2 years, they do a community health database, which is incredibly informative to us as we are making policy within the health department, and also so that we can share with you all what it is that's happening in your own neighborhoods. As you can see, there's been a drastic increase in the amount of Philadelphians who are uninsured in the past 8 or so years within the city of Philadelphia, starting off in the year 2000 with just over 95,000 individuals being uninsured, and moving to 2008 where almost 165,000 Philadelphians were uninsured. And as we know, when you don't have health insurance, that limits your access to care that you need, whether that's chronic care, preventive care, acute care. All of these things are limited when we don't have health insurance. And as of right now, we don't have the data for 2010, but we do anticipate, because of the economy and because of many other challenges that people are facing on a daily basis, that those numbers will increase. This is a map of Philadelphia, and it shows that throughout the city, there is a widespread amount of individuals who are uninsured. There's no part of the city that is not impacted by uninsurance. And the areas in red there indicate the areas in Philadelphia that have the greatest levels of uninsurance. And at the top there, we have the On the Oak Lane section. And not too far from here, right under there, Upper North Philadelphia, having one of the highest rates of uninsurance within the city. And then in the bottom there in South Philadelphia, also having a very high rate of uninsurance. Specifically here in North Philadelphia, 21.1% of North Philadelphia residents, so a little over 1 in 5 North Philadelphia residents and adults are without health insurance. And that's in comparison to the whole of Philadelphia, where 13.2% of adults are uninsured. And even that number is too high, but we definitely see that here in North Philadelphia, that's an issue that needs to be tackled. Also in North Philadelphia, there is the highest number of uninsured children, the highest rate of hospitalization for chronic diseases such as asthma, diabetes, and heart disease, as well as the highest level of adult obesity, asthma, smoking, and diabetes. PHMC has a great tool. They call it a report card. And what it does, it compares different neighborhoods and communities in Philadelphia with Philadelphia as a whole and the entire southeastern Pennsylvania region. So I tried to lay out here for you some information on the amount of people who are experiencing things on a disparate level here in North Philadelphia in comparison to Philadelphia and to the rest of the region. So here in North Philadelphia, there's a greater percentage of individuals who are in fair or poor health. Casey, a little more? Is this better? How's this, everybody? All right, I gotta have access to the computer. I'm so sorry. Oh, thank you, I appreciate it. So once again, the highest level of individuals who are in fair or poor health. As I mentioned before, the highest level of individuals who do not have health insurance. The highest level of individuals who have high blood pressure and diabetes, two challenging chronic illnesses that are very hard to manage, especially if you don't have health insurance, if you can't get the medications that you need, if you can't see the specialists that you need. Thank you. Also, 34.1% of North Philadelphia residents have a chronic condition where they need regular care. And despite this, almost 1 in 5 residents are without a regular source of medical care. So as we all know, that is a major concern. Almost 1 in 4 reported trouble getting the prescriptions that they needed because they couldn't pay for them. And also, over 15% report that they cannot access the health care that they need because they couldn't pay. So just to reiterate what Dr. Schwartz mentioned earlier, Healthy Philadelphia came from this 2003 ballot question that asked, should the Philadelphia Home Rule Charter be amended to declare that because health care is an essential safeguard of human life and dignity, the City of Philadelphia Health Department should prepare a plan for universal health care that permits everyone in the City of Philadelphia to obtain decent health care. To the next one. And this, once again, is another map. And we in public health, we love maps. So I just wanted to have one last one here this evening to show the entire city of Philadelphia and to show how you all voted on this ballot question. How many of you all voted in the year of 2003? A lot of hands in this room, and that's what makes it so meaningful. I know that we have the best people in this room this evening to share your stories because you all were out there voting in 2003, and whether or not you remember voting for this particular ballot question, it passed overwhelmingly here in the city of Philadelphia, particularly in this area. As you can see, that dark area that's on the map, that is where people voted most strongly for this ballot question, saying that yes, all Philadelphians should be entitled to universal health care within the city. Yes, please. Thank you. So finally, before I turn it over to you all, I just wanted to share one more statistic that I think is the best statistic, and it's probably the reason why you are all here this evening. And in this neighborhood in North Philadelphia, residents feel a strong sense of belonging, and they're very willing to help their neighbor. And this is some of the data that's included where I had all of those very sobering statistics, but this is an indication of why you all are here, this to become a part of a movement where we are looking to see how we can make sure that everyone has access to affordable, convenient, and quality health care. So thank you so much for your attention.